Hi, Dr. Larry Altshuler here, talking to you about healthcare and healthcare reform, telling you things that you will not hear from the media and you certainly won't hear from the politicians. Now, in the first video, I basically told you that both the Affordable Care Act and the Republican proposals for healthcare reform are not really going to work to reform our system, and in fact may be harmful. The reason for this is because neither side truly directly addresses the major problems that are causing our dysfunctional healthcare system. And that's what I want to talk to you about in this video. And in fact, this is the first of 3 videos that covers the major problems that we have. And after you see these 3 videos and look at the future ones, you will understand exactly why these reforms aren't going to make a dent in our dysfunctional system. So let's get started. Number 1, what is this big problem that really causes our system to be dysfunctional? Well, we can describe it really in one word, and that's called waste. Absolute waste. In other words, we do lots of tests and treatments and procedures that are totally wasteful. They are unnecessary. They are ineffective. Now, let me put this in perspective for you, because many studies have been done that show that up to 50% of our healthcare dollars are totally wasted. That means up to $1 trillion is waste, unnecessary, doesn't need to be done. Even Medicare in the recent few months admitted that up to 40% of their healthcare dollars is wasted, and I think that's an underestimate. So, number 1, we waste an incredible amount of health care. Now the question is, where does this waste come from? Well, again, the answer is really in one word, and that's called technology. In the last few decades, we've had an incredible boom in new discoveries, and I'm going to tell you the technology is great. Those discoveries are great. You know, that we have been able to make lethal diseases into more chronic diseases and cure many of them. We've been able to develop tests that can find almost anything and find treatments to treat diseases that we didn't have just a few years ago. There's no question technology is very important and has been a boon to medical care. But there's a downside to technology. That downside is, number 1, it's extremely expensive. The other downside is not as recognized, and that is it doesn't necessarily have good outcomes. And what I mean by outcomes is, does it improve our health care? Does it improve our health? Those are outcomes. And studies have shown that a lot of technology doesn't end up helping outcomes. It doesn't improve our health. That's for several reasons. One reason is because a lot of technology is unreliable. Another reason is because it's overused. And still another reason is because it's abused. Because people make lots of money off of technology even if it doesn't work. And there's a lot of greed and a lot of abuse. Well, when you put all that together, unreliable, overused, abused, with poor outcomes, what you have is unnecessary care, and very expensive unnecessary care and unnecessary waste. Now, along with technology, there's another problem, and that is that we've seen a shift from primary care to specialty care systems. Because, of course, one doctor can't know it all. So there have been hundreds and hundreds of specialties and subspecialties that have sprouted up to focus on one disease or one organ system or one cell system. And so we have become a specialty-oriented system. Now again, we need specialists to know all these things and how to use the technology, how to do these amazing procedures and tests. But again, like technology, there's a downside. And the downside is very similar. Study after study has shown that specialty care does not have better outcomes than primary care. And in fact, most of the time those outcomes are worse. You have a very fragmented system with specialty care. It's not cohesive. One hand doesn't know what the other hand is doing. And again, it is overused, it is abused, and it's very expensive. And when you put that all together, even with the good of technology and specialty, you're wasting a lot of money and a lot of time because you're not getting the outcomes you want, and it's total waste. And again, up to $1 trillion of waste. So at this point, you may be saying, well, wow, you know, we have all this waste. The studies have shown this waste. So why can't we stop this waste? And in fact, we aren't stopping it. In fact, we are actually promoting the waste. Now, this is the subject for the next video in this series of 3 on waste. And you can find this video in my website, balancedhealing.com. And also on that website, you can find a lot of information and books that give you exact examples of what I'm talking about, the waste, and what areas are wasted and not wasted. So I urge you to go to my website and look at all that information and look at my other videos. In the meantime, I thank you for spending your time visiting and listening to this video, and I hope you'll tune in to the other videos. Thank you.